Capstone and 5-Year Plan, Nursing 4580, Synthesis of Professional Nursing, Ella Kilchrist, RN, Lamar University. Graduated from Lafayette Regional Vocational School in 1989 as an LPN. Graduated from Lamar State College Orange in 2010 with ADN. Presently enrolled at Lamar University Beaumont to receive baccalaureate degree in nursing. Worked in numerous nursing specialties as an LPN and RN. In 2012, started working as a staff, then charge nurse in dialysis. Relocated to Houston, Texas in 2017 and worked as a clinical coordinator in an in-center dialysis unit. Currently working as a dialysis home care coordinator in a skilled nurse facility. Member of Louisiana State Nurse Association, the National Kidney Foundation, Black Nurses Rock, and Compassionate Friends Houston, BLS and ACLS certified. Humanity and Society Construct. Practices safe and effective, holistic, patient-centered to a variety of patient clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. Nurse 4540, Practice Care of Communities. Met in my online discussion assignment, Global Health, the Global AIDS Epidemic. Evidence-based findings included the use of medications given prophylactically to people who live in higher risk areas decreases the spread of HIV. Objective met at 93%. Also, Nurse 4316, Comprehensive Holistic Health Assessment, met with Shadow Health by demonstrating the components of a holistic health assessment across the lifespan in my comprehensive assessment and documentation. Objective met at 90%. Lifespan Health Continuum Construct supports patients and our clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. Nurse 4620, Nursing Practice, Compromised Multiple Health States. This was met in Practicum Reflection Number 3. Data that was obtained in Practicum Reflection Number 1 was used to develop a teaching plan and advocacy plan for the patient with a compromised health state. Objective met at 96%. Lifespan Health Continuum Construct evaluates patient-centered care for patients and our clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. Nurse 4620, Nursing Practice, Compromised Multiple Health States. This was met in Practicum Reflection Number 2. Measurable goals were developed using evidence-based practice for the patient. Multi-determinants were identified, with depression being the main focus of depression and anxiety in the elderly hemodialysis patient. Objective met at 86%. Evidence-based practice and clinical reasoning construct synthesizes clinical and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. NURS 4390, nursing inquiry and evidence-based practice. This was met through the quantitative research article critique, where scholarly critique was used as a guide to evaluate and utilize research in nursing. Objective met at 91%. Also met in the quantitative research article discussion, where a qualitative study on the role of patient-nurse communication in acute cardiac care using the research process, nursing inquiry, and evidence-based practice. Objective met at 95%. Patient-client-centered care. Employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patient and/or clients and members of the interprofessional and intraprofessional healthcare team. NURS 4550, Nursing Practice, Leadership and Management in the Healthcare System. This was met in my practicum assignment, Clinical Application Assignment. A problem in my clinical setting was identified, which was hand washing. Once the problem was identified, I evaluated the problem, then developed and implemented a patient-centered care using evidence-based findings. Objective met at 96%. Professional roles construct. Differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients and our clients as a member of the interprofessional and intraprofessional healthcare team. NURS 4321, Nursing Theories and Online Education. This was met in Module 4, Ethical Issues. In this assignment, I discussed an ethical dilemma that I had encountered in my practice using the 4 concepts of ethical principles. The discussion centered on identifying the ethical problem, which was reporting HIV positive clients to HIV negative partners, how it was and was not resolved, and changes that are needed for improvement. Objective met at 98%. Professional roles construct. Demonstrates professional integrity, effective communication, active inquiry and service to the community. NURS 4540, Practice, Care of Communities. This was met with my project video 5, The Importance of Being Prepared in a Disaster. The presentation was presented to in-center hemodialysis patients. The content on disaster preparedness was expressed professionally, and the steps to successfully discontinue dialysis treatment